Hi, my name's Deanne Richards, and I'm an infection preventionist. Today's topic is, what's the big deal about COVID-19 on the job site? Well, the reason I wanted to talk with you today about this is I wanted all individuals to understand the importance of acting immediately and quickly and how we can prevent exposures in the construction industry. So I'm going to start with an example. In this example, on Wednesday, our employee decides that they're really not that sick. They can push through. They can continue to work because they normally would. They've got some muscle aches. They're not quite feeling well, but big deal. I can continue to work. Well, they make it through that work day on Wednesday, but on Thursday morning during the temperature check, that they're found to have a fever and they're sent home and they're asked to seek medical care. Well, the employee does follow through. They contact their primary care provider and they talk together and find out the best option is really for the employee to go to a test center for COVID-19, and the employee decides to do that on Friday morning. Now, the results for COVID-19 aren't immediate. They can take some time, between 1 to 3 days, depending on how important it is. So maybe the individuals in the hospitals are ran first before the individuals in the community. But in our example, the local public health is monitoring those COVID-19 results, and they're contacting individuals who are positive as soon as they receive those results. So in our example, the employee is actually notified by the local public health then on Sunday that they're positive. And much like the employee was told on Friday, public health is reinforcing with the individual what they need to do to prevent the spread of COVID to others, including within their own home and out in the community. Now, it's late on Sunday, so the employee decides they're going to wait. They'll call Monday morning. They'll let their boss know then, because what's the big deal? Well, the fact when the employer receives that call, in their mind, what they're really asking is, what now? What am I going to do with this? The first question we recommend in your exposure evaluation is, what date did you first feel ill or had your test collected? So let's go back to our example in which the employee become ill on Wednesday, but yet had their test collected on Friday. We look for the first date, either the test being collected or the illness. So in our situation, Wednesday would be the first date, and we would use that then as the answer for question number 1. So then our next question would be, when did you start to self-isolate, or when did you quarantine? So that's going to be our end date, so that we know for our example here that it's going to go from a period of time, because the reason we need to know that is our next question is going to be following is from that beginning date to the end date. Did you work during that time? So again, in our example, we know that our beginning date for that job site that the individual could have spread COVID-19 started Monday. Now, from talking to the employee, they really didn't think that they were that sick, and so they really, didn't stay at home. They went out, they did things, they wanted to get things done, they did a little shopping. And they actually didn't realize how serious it was until they were having their COVID-19 test done, and they were told that they had to stay home. They could not be out in the community. They needed to stay home until they received the test results. So when we ask, when did you work during this period of time, and we look at the example, we can say for this example that the employee worked from talking to them Monday through Thursday. So that's the time period we know for our job site that we're going to be the most concerned about. So our next question then for the employee is, during that time, what job site did you refer to? Now, being in the carpentry industry and the construction industry, we know that we may have multiple job sites. So we need to clarify, what that job site truly was. And then we want to ask, what tasks did you perform that each day? Now, the reason I'm encouraging you to have a calendar in front of you and start with what days did you work and then what tasks you did. As adults, we tend to remember days better based off of events or things we completed that day. And then after you figure out what tasks were done each day, that's where you may want to then go to the next question of where did you go to do that task? Were you able to stay on one floor? Let's say you have a 14-floor construction site. Were you able to stay on floor 3 while you were doing that task? Or did you have to go up to 10 to retrieve a tool there, and then down to the basement to retrieve supplies, and then come back to 3, but then break rooms on 4 and restrooms on 5. So you want to have the conversation of where they actually went on that job site. The reason is much like buying a house, it's all about location, location, location. Question number 6 is, did you wear a face covering while at work? The reason we're asking for this clarification is if the infected individual was wearing a respirator while at work, we would not consider this an exposure situation if they always had the respirator on. If they were wearing a fabric face covering, although recommended by the Center for Disease Control, they are very clear to indicate that fabric face coverings are not considered personal protective equipment and is not taken into consideration during an exposure situation. Please keep in mind, though, if the individual or coworkers were all wearing respirators, they cannot eat and drink with those in place, and communication may be difficult, so you may still need to proceed on with number 7 for your question, which is, while on the job site, were you within 6 feet for 15 minutes or more? Keep in mind that 15 minutes is for an accumulative total over a 24-hour period, starting from the 2 days before the illness onset or the test collection of any other individuals. These individuals would be considered a close contact and would be potentially considered exposed. So what are you going to do? Well, you're going to start to create a list of possibly impacted individuals. Now, this is going to be including what the employee recalls, especially if the employee says, yeah, I was starting to cough, and Dan was next to me during that time, and we were doing fitting work, and both of us were holding the window in place while we were ensuring that it was installed correctly. Those are things you're going to want to note on that list of possibly impacted individuals. You're also going to want to review your worksite documentation. So were you having deliveries that were occurring on that day? Were there other items of key tasks that were occurring on that day that might have brought additional people together? And then also recall from additional staff. This could be the superintendents, it could be the foreman. What do they recall from the day? Was there anything unusual or different, again, that would have brought individuals together? So what are we going to do with that? Well, first thing we want to do is notify individuals that potentially were exposed, but keep in mind we have to ensure the confidentiality of the individual who is actually positive or diagnosed with COVID-19. So we're not going to say Deanne was positive. We're going to say on the job site on Monday, you may have possibly been exposed to COVID-19. The next item that we're going to ask for is the best method to be contacted, and that's typically a phone. The reason we're collecting that is the more information public health has about the name of the individual and how to reach them, the quicker they can actually reach out and have that discussion with them. We're also going to ask these employees that were potentially exposed to leave the job site and wait for public health's phone call. And you are going to turn around and let public health know that you're the employer, that you're working with your employee, provide them with the list of names you collected and the phone numbers to best reach them. On the local public health end, what they will do is not only just interview the ill employee and educate on how to prevent that spread, they're also collecting from that employee how many individuals meet their definition of close contact, and then they're reaching out and interviewing those contacts, typically by phone. And then after that occurs and during that discussion, they can ask those additional questions to figure out, could this have been a situation where they were close enough that germs could have occurred? And based upon each one of their discussions, they actually explain to the individual they're talking to of what they want those next steps be. Now, if they determine, yes, it's a close contact, that they may actually explain to the individual on the phone, for the next 14 days, I need you to stay at home. I need you to not be with your family, so I need you to stay 6 feet away from your family members who are living within your home. And I also want you to wear a fabric face mask while you're at home. But again, for each and every situation, they're going to give them the best direction to follow, because they're also going to take into context what's happening in that home. So it may be that the exposed individual already has a significant other at home who is already positive for COVID-19 but has cleared. So what does that mean for them to restart quarantine? And what does that mean for that whole family? Again, that's why I have to emphasize local public health is so key in making this decision and giving the best directions for how to handle that situation for each and every one of those individuals. So again, why is this so time sensitive? Well, the reason is there's just a big word we like to use in healthcare called the incubation period. And that is a fancy term for saying, after you're exposed, how long do we need to wait to find out whether you're going to develop the same disease or not? Now, COVID-19 is a really long incubation period with 2 to 14 days. So even in our example, when we look at that, that means that we start on Monday, that first day that we could have exposed others within our workplace. That continues to be on that second Monday, and we're almost to that third Monday. That means for us, the employer, that during that whole period of time, it's almost like holding your breath, hoping that no one else becomes ill within your workplace. But no. We have another employee that becomes ill. And let's say it's a worst case that they become ill on Saturday. They're off Saturday and Sunday. I'm not going to really tell my employer because, Monday I'll feel pretty good and I can go back to work. But if you have another individual who becomes ill on your job site, you have to start the whole process of questions all over again. You can't just assume, since you took care of that first employee, that you don't need to do anything else for the second. You actually need to start with that first question. Part of that time sensitivity is right now, what we're being told is that for every individual who develops COVID-19, they have the likelihood of spreading it to 2 to 4 individuals. We call this a reproductive rate. And statistically, it's between 2.5 to 3.5 people. Now, in your mind as the employer, you may be asking yourself, wait, I'm never going to get ahead of this. We're always going to have more exposures. How do I stop this from happening on my job site? What we're really going to encourage you to do is really look at reducing your workplace risk by reducing those that potentially could be exposed. And let's talk a little bit more about this. In the diagram that you see in front of you, I have low risk, medium risk, and high risk. So I've got green for good for low risk. Medium risk is usually in caution. We know you're going to need to use that within a construction or in the carpentry field. And high risk is really relook at the situation that we really don't want to be touching red during this pandemic. And then I broke it down into exposure factors. So let's talk about each one of those rows. So the first is location. The lowest risk in our work setting is outdoor work, where the highest risk would be if we have a large team working in multiple areas throughout our construction zone. Our minimum of our medium risk Ideally, we would want to make sure that every employer, if they have to do inside work, really determines how to make a team with no more than 10 individuals, and that team is specific per location. So if in my example, that if this individual worked on a team of 10 or less, that would mean only 9 other individuals were exposed compared to 50 other individuals. The next area I want to look at is breaks or lunches. Our low risk setting would be that we allow our employees to eat outside with physical distancing, so we're still going to enforce that 6-foot distance, or we allow them to go ahead and eat alone in their own vehicles. Gone are those days that we would just say, oh, break time, everybody head to that break room, and we would pack as many people into that break room as possible. Minimally, to hit that medium risk, we really want to look, if you're going to use a common space, try to set it up that there is physical distancing. You may have to remove chairs, you may have to remove tables, but you also want to make sure you're only allowing 10 or less individuals in that space at any given time. So you're going to have to kind of, stagger your shifts and your breaks to do that. But we want to make sure, again, that we're limiting the amount of individuals that could be exposed if somebody was positive. The next area we're going to look at is physical distancing of 6 feet or less. So our ideal is that we would always be able to have 6 feet or more. Gone is the days of where we'd be working in the higher risk, where we're side by side, no protection, multiple interactions, doing a lot of work, a lot of conversations in close proximities. What we're trying to minimally get to is that medium risk, where if we have to do work, and again, we know this has to occur within construction and the carpentry field to do our job safely and correctly the first time, that there are times we need 2 or more individuals to do that. So when that does occur, we want to have a plan in place. That plan may include some physical barriers. It may be a decision that let's add a face shield over our eye protection and our fabric face covering or mask while we're doing that work within 6 feet or less. Or it may be, what can we set up and do individually so that when we have to come together and work shoulder to shoulder, that we can actually do that in a very brief time. So rather than work a longer period of time together. Our next area is the fabric face covering or mask. Our ideal is that everyone is wearing that other than when they're eating or drinking on site, versus believing it's not really necessary. But we're trying to reach at least minimally that medium risk, where we have that on anytime we have 2 or more individuals that need to complete that job and we just don't have that ability to do the physical distancing. Another item we'd want to consider is hand hygiene breaks. Our ideal, our green, would be enforcing multiple times during the day to say, okay, crew, I need you all to go clean your hands, versus just thinking that when they get to it, they get to it. It's a dirty job. Why clean our hands? It's just going to get dirty again. Versus trying to at least minimally get to that minimum risk of, okay, your group, you are set for break. The very first thing you're going to do is you're going to head over and clean your hands at the hand sanitizer station. And the same thing, ensuring that they do that with lunch. And maybe that's every time that they touch supplies that have just been delivered to the site. Again, really think and focus about how you can clean those hands. My reminder for our field is that many times we're finding that we're wearing safety gloves to keep us safe. Remember, safety gloves do not prevent the spread of germs. One, it's not a substitution for cleaning your hands. Germs will go through safety gloves. And even for us in the medical field, there can be small holes in our medical gloves and the germs can still get through. The other is that when you're wearing gloves, it really prevents you from cleaning your hands, and that's ideally how we can prevent that spread from that hand-to-hand transmission, we like to call it. So we need to ensure that we clean our hands. The other is that gloves can actually pick up more germs than our bare hands and spread it to other areas. So the last row I have in my grid here is on cleaning and disinfection. Now, high risk would be our pre-COVID pandemic where we would just clean at the end of the day. It's just, yep, you got time to lean, you got time to clean, let's just do it at the end of the day. Where our ideal and low risk would be that we enforce it multiple times through the day, that we are verifying by checking the EPA end list that the disinfectant we're using is actually effective against COVID-19. And in addition, we are actually observing our employees. We're watching to see what they're commonly touching. Is that a handrail because we're using the stairs rather than the lift? Is it because we're going in and out of a door? We may have to even ask ourselves, do we really need to touch that door handle? Could we, by fire code, could we go ahead and open it up while we're working here so that nobody has to touch that item? But there's going to be things that you will need to address, such as the bathroom door even. And then the other would be minimally, we're going for that minimum risk. We want it multiple times during the day. Make sure that we are cleaning and disinfecting with a common disinfectant. So ideally, what we're striving for using this grid is our goal is to hit green as much as possible. We know that we will need to use yellow periodically, but we are trying at all costs to stay out of the red so that we minimize who is being exposed. In my final slides, I just want to remind you that we continue to need to practice safe practices in our workplace, and we need to continue to take these practices outside of our workplace and continue to do these same things in our community and our home. This includes cleaning your hands often, avoid touching your face, staying home when you're ill, using a fabric face covering when you're outside of your home environment, ensuring that physical distancing of that 6 feet between you and the next individual if they don't live with you. Another is covering your cough and sneezes, and finally avoiding close contact. I want to thank you for your time that you've spent with me today, as well as I want to continue to encourage you keeping those safe job practices, because again, we can all work together to have a safe job, a safe community, and a safe family. Thank you.